We're here with Jim Browning with Injury Solutions and Sports Performance. Jim is a specialist in the soft tissue, muscle area, and he is going to tell us or talk to us a little bit today about how we can overcome some of the tennis and golfers' elbow issues.
Dave, over the last probably 10 years, the industry of soft tissue therapy has really come into the forefront. And it's a team approach. There's, on any given sports team, you're going to have doctors, chiropractors, physical therapists, and physiotherapists like myself who specialize in the soft tissue treatment, because most of the injuries do happen first with the muscles or the tendons, especially the repetitive use injuries like what you're suffering from. And there's a paradigm shift that's going from just calling everything tendonitis to really what it is, which is tendinosis.
Right.
And that's the big difference, and that's really going to determine how you want to treat it and when you're going to treat it. Somebody like yourself, as a tennis player, this problem, and you've got medial epicondylitis, and we'll go over that in just a second. Even though it happened one day,
right,
that was just the straw that broke the camel's back.
Right.
This has been a cumulative tissue disorder or syndrome that's been accumulating for probably, I'm guessing you've been playing tennis since you were a little kid, but you've been playing probably more so in your adult life, and that's when the tissue quality changes, and that's when these conditions do occur.
So would you, a good analogy would be the wearing of a car tire. Over the years, you don't rotate it, you don't take care or maintain that tire. It hits a rock or a nail and it just explodes.
Perfect. And that does go with more what I do in my analysis and treatment in balance.
Right.
The body has to function, and it needs to function together, much like a golf swinger. So how can Tiger Woods hit the ball 360 some yards?
Right.
Every ounce of his body and his mechanism of swing is going to propelling that golf ball. Same thing with tennis injuries, and a lot of times this injury will happen because of a breakdown in mechanics or overhitting, trying to hit the ball too hard or putting too much spin on that. And the weak link in the body is usually at the joint,
Right,
where there's a lot of moving functions, a lot of moving parts, tendons, ligaments, a joint, and a lot of muscles coming together.
So our condition, we're mainly talking about the muscles, soft tissue, and tendons, not so much ligaments, correct?
Right, right. An injury with a ligament is more of a sprain.
Okay.
And once that ligament is stretched beyond limits, it's not going to go back unless you have surgery, or a better option would be to strengthen the supporting tissue around it. And that's why an ankle sprain that you've sprained repeatedly is more prone to being twisted again in the future.
So if I play the guitar a lot, I'm going to possibly develop tendonitis or later on, if you do it long enough, is tendinosis. Okay.
Well, let's talk about your injury specifically. And this is, I'm going to use this arm since we're closest here. There's two types of epicondylitis with most athletes. The tennis players, typically it's called lateral epicondylitis, and it involves the extensor muscles. There's three extensor muscles that originate from that little bump, which is called an epicondyle, a lateral epicondyle. And with the tennis motion, most of the time it's from the backhand because you're using those three extensor muscles. That's called tennis elbow. Switch it over, medial epicondylitis, you have another bump right there, and those, you've got three muscles that are flexors, plus another one or two muscles that come off of there. And when these muscles get overused or tight, then you develop medial epicondylitis. And typically with golfing, you use more flexion in the golf swing, especially with right-handed golfers. Left-handed golfers, it would switch.
Right.
But you're turning the golf club over, so you're getting more flexion, and that's what develops into medial epicondylitis or golfer's elbow. And I treat it all the time. I treat tennis players with golfer's elbow and golfers with tennis elbow. It doesn't really matter. And it doesn't necessarily have to be a sport. You can get tennis elbow from screwing in switch plates, from using cordless drills, building decks, or from hammering. So, and it typically does, I hate to say the word aging process, but you can do anything you want to do in your 20s and not get injured. You can play 6 hours of tennis go out the next day and play another 6. What happens as we age is basically the tissue dries up and it tightens up. So that's the importance of hydration and stretching. Now, once the problem occurs, and let's distinguish the difference between tendonitis and tendinosis. Tendonitis is just inflammation of the tendons. It would be an acute injury that happens, and the best thing to treat it with is ice because it's inflamed.
Right.
Ice and possibly NSAIDs. The problem with conditions that are repetitive use is that it's not just tendonitis, it's also tendinosis, which involves a chronic tightening of the muscles in the tendon. So the tissue actually does change. And a lot of times in tennis players, if you rub the muscle, it'll feel like a rope or a band, and that should not be there. What that is the fibers of the muscles have gotten tight and fibrotic and almost like a cord-like or a cable-like. And that will let you know, the severity of the tightness will let you know this is probably more a tendinosis or repetitive use injury. So it's not just an overuse, but it's a repetitive use injury. The best way to treat that is multifold. You're going to involve some icing, but you're also going to do some manipulation or massage or myofascial therapy or ART, which is what I do, active release technique, to actually break up the scar tissue. And the word is scar tissue or adhesions. That's the ropey-like, the fibrotic tissue. And what happens or why that develops is basically due to a condition called hypoxia or lack of oxygen. The repetitive use of this arm doing hundreds and thousands of tennis swings, or in a musician playing a guitar, or any repetitive use. It could be an assembly line worker who's screwing in a widget. What happens is the muscles get tight and tight and tighter and tighter and tighter, and then blood and the interstitial fluid gets kind of choked away from the tissue. And blood and the interstitial fluid is what's going to deliver oxygen to the body or the tissues.
Now,
and
does that also come with age?
It does come with age a little bit because the tissue, again, is getting tighter. It just doesn't have the resiliency that it used to. One of the other things with this particular injury is you want everything to work the way it should in supporting cast of the injured tissue.
Right.
And what's happened is the tight flexor muscles, these muscles become tighter and tighter and tighter, and they put extra friction and tension on the attachment site. So that's why the inflammation and the injury occurs here.
Because they're pulling on that tendon.
Because the pulling of the tendon. Okay. And also, you've got other supporting structures like the biceps, like the pectoralis muscle, like the subscapularis in the shoulder. And this is what's known as the kinetic chain. You want everything that's going to help you accomplish your task, like the tennis forearm or serve. You want all that working in conjunction, in harmony, so that it lessens the responsibility or the need for these muscles to overwork.
Okay.
And another thing that happens, you hear about weakness, and I always look to address tightness first. Let's get the muscles to function the way they're supposed to by eliminating the scar tissue. The deltoid muscle is very similar to the glute. A lot of times the deltoid, like our glutes aren't used. They're huge muscles, but they're not used properly because they are weak or they're inhibited. So a lot of times it's let's get the delt working first, then the other rotator cuff muscles, which I know you hear about. Sure. It's important that they work together too, so that the whole arm, not just the elbow, works along with to carry out the stroke or the mechanism.